So let's look at pushing cues. So traditionally, this is usually what I see in the labor room is, all right, inhale, take a deep breath, hold your breath, now curl around your baby and bear down. Is usually the sequence of cueing that I hear. And usually the knees are super wide, so really widen your knees, make room for the baby is sometimes another phrase that I hear. So the inhale and holding your breath is purple pushing. So you're holding the breath and you're just bearing down as hard as you can. Usually the inhale is not contributing at all to the push, so it's just bringing air. Usually I'll see birthing persons just lift up like this, so that essentially they can like generate a lot of power as they curl over. Curling around the baby's thought processes is if we kind of put compression onto the abdomen, it'll push the baby out more. And then the wide knees is, well, if the baby's coming out of here, if I widen my knees really wide, it's going to make tons of space for the baby. So if we have our pelvis and we widen our knees really wide, so external rotation of the femurs, it's going to close the outlet more, so it's going to decrease the space side to side for the baby to come out, as opposed to knees in, ankles out, which is going to widen that space more side to side. So it's essentially the opposite of what we're usually cued. Wide knees versus knees in, ankles out is going to widen that space even more. So other options for pushing. Now, these ones are not necessarily wrong by any means, but we have other options that we can use as well. So we can use a gentle breathing technique where you're going to inhale to baby. So we're really focusing on that diaphragmatic breathing pattern here. So inhale, feel the pelvic floor load and lengthen. So inhale to baby as opposed to chest. So inhale down, feel the pelvic floor bulge. Exhale to maintain that pressure and bear down. So this is a great one to practice on the toilet or to encourage your clients to. So they're going to inhale on the toilet. They should feel their pelvic floor and perineum bulge. And then they're going to maintain that bulge as they exhale. So this is going to incorporate both the inhale and the exhale to bear down. Now there might be times where the birthing person will choose to hold their breath during this. So it'll be like a combination of both purple and gentle. So they'll take their big inhale, so the inhale is contributing towards the push, exhale as they go. So they might hold the breath at the end. So a combination of both is perfectly fine as long as it's self-directed. The birthing person should choose how they breathe. Now, if someone has an epidural and they don't feel quite as much, or someone isn't quite getting it, where they're like, am I doing it? Gentle breathing might be really hard to do because sometimes it doesn't seem like it's as forceful, and so if you're not sure how to do it, it'll be fairly ineffective. So the purple pushing could be more effective at that point. However, we do want to try to maintain more of a neutral spine. The reason being is the diaphragm's line of force onto the pelvic floor. So if I have my diaphragm and it's stacked over my pelvic floor in a neutral position, the line of force is going to be directly down. If I curl around my baby, so bringing my ribs down, my pelvis is probably also going to tilt upwards. My line of force is going to be more towards my back, so not quite on my pelvic floor. And then the same for the opposite if I arch my back. Line of force is going to be a little off. So if we can maintain a neutral spine, it's going to put our diaphragm into a more optimal position to assist with that push. So diaphragm is stacked, so I can inhale and use that as a part of my push, and then exhale or hold my breath to bear down. The other thing is going to be that internal rotation of the femurs. So again, we want knees in, ankles out. It's going to open the space of the outlet a little bit more. Then super wide knees. And then again, it should be self-directed. The birthing person should get to choose out of all of these options which ones they want to do. Maybe they do find curling around their baby to feel more effective for them. Maybe they need to hold their breath because they're not quite getting the gentle pushing. Maybe they don't want to hold their breath. They only want to gentle push and they want to exhale and they want to maintain their neutral spine. So again, should be self-directed. The other thing to consider is the difference between like a high-pitched scream versus like a deep grunt as someone is pushing. So if we have like a really high-pitched scream, so kind of noise, if you make that noise, you'll feel your pelvic floor tighten. So again, we want the pelvic floor to relax so that baby can pass through. So high-pitched screaming noises could tense up the pelvic floor and keep it from relaxing and opening, and could prolong pushing. As opposed to like a deep grunt, like, ooh, you could feel the pelvic floor open when you make that type of noise and kind of push down and relax. So if someone is going to make noise while they push, as opposed to screaming, I would say more of like a deep grunt or moan noise is going to help emphasize opening of the pelvic floor and assist with their push better. So usually when you see birthing persons that are towards the end of their labor process and they're starting to bear down, they're going to they're going to have really deep noises as they do it. So we want to continue to emphasize that. If someone has a really high-pitched scream, sometimes reminding them to breathe can be really helpful. I wouldn't recommend yelling at them by any means, but talking to them calmly and saying, hey, take a deep breath to your baby, exhale, let this one go. Okay. Now let's do this again. And sometimes educating them on the difference of what a high-pitched scream is going to do to their pelvic floor versus like a deep grunt. So in review, the traditional way of coaching someone to push is going to be to inhale, hold your breath, curl around your baby, make space for your baby by widening your knees. But we have other options. Again, these should all be chosen by the birthing person. You can do gentle breathing where you inhale to your baby, so expand in that pelvic floor, perineum bulges. Maintain that bulge as you exhale the air out. So keeping the throat open is going to help, again, relax the pelvic floor, as opposed to clenching in the jaw is going to tighten the pelvic floor. Maintaining a neutral spine is going to increase the effectiveness of the diaphragm to put force onto the pelvic floor, making all of this pushing way more effective. Knees in, ankles out is going to open the space more side to side, and ultimately this should be chosen by the mother.